So these are the recommendations if we find out or make a diagnosis of HIV in pregnancy. Key points is that understand that the person may be in shock, so they need some time to process the information, offer support, and tell about the management. So we need to start the antiretroviral management for two aims: to support women's health and restore the immune system, and also to suppress the viral replication and to maintain the viral load very minimal, so there's less chance that it can be passed to baby. So it doesn't matter what the levels of the CD4 are, but it's more about viral load and also minimizing the chances of vertical transmission. It says that babies, if the treatment is combined treatment and the viral load is not detectable, women can have a vaginal delivery. But if the viral count is over 400 or there's any complications, there will be a organized planned cesarean section. So treatment may have some adverse effects that include hyperglycemia, anemia, and hepatic toxicity, and that can have a negative effect on the mom or in the fetal outcomes as well. It's important that women are recommended not to breastfeed because unfortunately they will pass infection through the milk. Other things to consider in these persons are screening for psychiatric or neurological disorders, do the normal screening for diabetes and hypertension, but also full evaluation and support, assess risk of tobacco smoking and also alcohol and drugs, and check if there's any partner violence, see if they have the immunizations, STDs in history, and do a full assessment and invite women to come to regular antenatal cares, try to follow up, engage social worker, counseling if needed. Obviously, this is a high-risk pregnancy and needs to be managed by obstetrician and HIV specialist, and also involve the psychologist. So investigations, we need to do a viral load at the initial visit and then 2 to 4 weeks after starting or changing the antiretroviral treatment every 4 weeks until undetected, and then every 3 months, and at the 35-36 weeks to make a decision of the mode of delivery. Apart from the viral load, we also need to do a full blood count, CDC cell count, and lymphocyte subsets. And don't forget the lower vaginal swabs and cervical smear. Postpartum will be to support giving the formula and discourage breastfeeding, consider lactation suppressant with some medication, and then revise with the specialist the antiretroviral therapy that patient needs to be taking, and importantly, contraception and safe sex advice.